Okay, I'm Dr. Deuk, and I'm sitting with one of my patients who, how did you find out about Deuk Spine Institute?
From the racetrack.
From the racetrack. Right, because you're a mechanic tuner.
A karting mechanic tuner.
And you've watched Arias drive?
Yes.
And what do you think about Arias?
He's a good driver.
Yeah, thank you. So, why are you here today?
I'm here as my follow-up after I had surgery, laser disc surgery on my back, and to tell Dr. Deuk the results, which were phenomenal. I mean, I couldn't even sit for 10 minutes. I mean, I get emotional because I didn't see much future for myself, and now my pain's gone.
So that back pain can rob you of your independence and your dignity, huh?
Yeah.
Yeah. And it's hard to go to a racetrack and do your job when you're suffering?
Well, yeah. I mean, and I went last week. I couldn't work because I was in such pain, but I saw the doctor there and he could see what pain I was in. I was in pain just to be there. So,
yeah.
Very grateful.
That was down in Miami, and you came in on Tuesday, so less than a week ago. You came in, 6 days ago, had your Deuk laser disc repair. We fixed 3 herniated discs. And that back pain you had before surgery, tell me about that now. Is that still there?
No. No, I'd say 98% or more of the pain is gone. I mean, I feel no pain.
Are you on pain pills right now?
Yes, but not because I have a lot of pain. I took one before I rode up here because it's a 2.5-hour ride and I didn't want to end up in pain.
Okay.
But I've taken maybe one a day.
All right, good.
And I've not been in pain. It's just a little funny feeling.
Mm-hmm.
But it's not painful. It's just an odd feeling, which is just the surgery, I believe, healing up.
Yeah. Now you had leg symptoms too, didn't you?
I did. I had weakness and tingling and numb from my knee down.
And you told me you couldn't cock your foot up before surgery. Let's take a look at his right foot now. What can you do with that right foot?
Well, I mean, if you look, I don't know if it'll show on the video, but this muscle was getting small on his leg because I couldn't.
Show him how you can move your foot right now.
Now I can pull this foot.
Look at that.
All the way up.
So he had
before I couldn't pull my foot up to here.
Good. So you had a drop foot. He had what we call a drop foot. That's basically where the herniated disc is pushing on the nerve going down the leg to the muscle that cocks the foot up. That nerve was getting pushed on so badly by the herniation that he was dragging his foot, which along with the back pain, the dragging foot, leg pain, how are all those things now, a week later?
Gone. Much better.
What are you going to do now that you're feeling better?
Follow your instructions and rest.
Yeah, that's a good start. Are you going to go back to work on the go-kart track eventually?
Yeah.
All right.
Yeah.
Very good. Anything else you want to say to your audience?
Just, if you have the means to do this, you should do it because it's life-changing. Thank you.
You're welcome. I'll see you out there on the go-kart track.